Good morning. Myself, Dr. Aarti Welling, Associate Professor, Department of Orthopedic Physiotherapy, Cayley Institute of Physiotherapy. So today I'll be demonstrating on the two techniques of myofascial release, which is given for cervicogenic headache. So just a brief description of what happens in cervicogenic headache. Cervicogenic headache, being secondary headache, is a type of headache which occurs unilaterally, which is one-sided, and because of this there is involvement of C1 C2 vertebrae, and this results in restriction of flexion rotation range. So before I start with the technique, I will just show you all the restriction which is present while we are performing flexion rotation test in cervicogenic headache. Basically, the techniques that I'll be teaching you is dural tube stretch and compression. So according to the new diagnosis of cervicogenic headache which I have come across, there is something called as myodural bridge. Now this myodural bridge is a missing diagnosis for cervicogenic headache. So basically what this concept states is cervicogenic headache occurs because of restriction of the suboccipital muscle structures, and these suboccipital muscles, which are rectus capitis posterior and obliquus capitis, are connected to the myodural bridge. And this myodural bridge is connected to the dural tube, which is a protective covering of the spinal cord. Dural tube normally has the capacity to move slightly during any flexion movement, rotation movement. But if there is tightness in these muscles, that is the suboccipital muscles, the myodural bridge, which is connected to the dural tube, also goes into tension, which indirectly restricts the movement of the dural tube. And that's the reason these patients commonly start developing frequent headaches, which is one-sided. So let's do the test first, which is flexion rotation test. In this, patient is in supine position. Come out of the couch. You have to get the patient out of the couch and then completely flex the neck and rotate it. Depending on which side you can feel the restriction. You can also use a digital goniometer to assess the range. Currently, this patient is having left-sided restriction. We'll just compare it to the right side. The left side is more restricted in this patient. So he complains of pain on the left side. Coming next to the dural tube stretch. So in this there are two techniques in dural tube release. We'll be performing dural tube stretch and compression. For this, the patient has to go in side lying with the lower limb slightly flexed towards the patient, head in neutral, shoulders perpendicular. So we have to start from the center, maintain this grip, and then give a stretch. Now this stretch has to be maintained for 30 seconds and it has to be stretched completely up to the sacrum and the occipital area. So this stretch has to be maintained for 30 seconds, as I said, and it has to be divided into 3 sets, that is 30 seconds, 30 and 30. So total 90 seconds, because it takes around 90 seconds for a fascia to release. So you can do this in one set, and the compression is the opposite. This is the stretch for compression. One hand is at the occiput and the other at the sacrum, and then you have to get both your hands together. This also should be done in 3 sets of 30-30, total 90 seconds. So after doing, you can perform this for around 2 sets or 1 set, depending on how comfortable the patient is. And following this, you can assess the flexion rotation range for the patient to see how far the patient has improved with this myodural stretch.